I'm John Woodrich. I'm the Chief Operating Officer for the Medical Center. I've been here a little bit over 9 years. I have quite a bit of information to cover with you today, but as we have in the past, feel free to raise your hand and ask a question at any time. We will take questions at the end. You feel more comfortable writing your question down on a card. You have those in front of you. Do it, pass it to the center, and we'll pick those up at the end. And just another reminder, if you have questions about food service, see Mike Dixon. You do not need to write that on a card. We have a lot of items to cover today, and there's going to be some folks that help me, so I'm going to talk a little bit about our organizational-wide goals for 2018 that we just completed. And then Jerome Berry's going to talk about must-haves, and he's part of our patient experience team of directors. And then Brooke's going to talk about Pulse, which is our employee engagement survey. I'll give you some updates on some of the construction projects. And I think last time, if you recalled, we talked about security enhancements. I want to update you on some of those that have occurred. And then Lisa Vale's going to talk about our pain management and opioid stewardship program. Talk a little bit about MyChart, bariatric accreditation that we received, community outreach, which is you can go on to Hello and click on the button and fill out a form, and we can help support some of the agencies here in town or groups or organizations. And then some new templates that we use for our branding, and then some dates coming up. So organizational update, I do not have one. This is where we typically insert the slide with all of our latest and greatest outcomes. And at the end of the year, we always delay because when we try to close our financial picture, we have auditors come in. We always want to make sure we give you the final number, so that's delayed. And even a lot of our quality metrics, some of those you have to wait 30, 45 days. So those have just closed out as well, so we don't have that for you. You knew of our employee engagement score. Our physician engagement score was good as well. And that type of information, once we get it all, we'll send it out to you. So I didn't want to give you kind of interim numbers yet, kind of close out the year so you can see our finals for the entire year. Then with that, I'm going to turn it over to Jerome, and he will cover the must-haves and the patient experience team.
Good afternoon, everyone. My name is Jerome Berry. I'm a director in patient care services with responsibilities over LifePoint Independent Center and pastoral care. I've been here 19 and a half years, so got here in November of '99, right about a year after the merger. But that's not why I'm up here today, and none of those reasons. I'm the part of a 4-person director group, and we call ourselves the Patient Experience Oversight Team. So that's Wendy Muir, Ellen Beans, Sharon Harms, and myself. And we've been taking what I call a deep dive look into everything that has anything to do with the patient experience throughout the organization. The reason why we've been doing that is, when John gets up here and shares the data, I don't know about you all, but I leave a little uncomfortable when I see the red and the yellow that's up here, and then I think about the people that we have working and providing patient care services. It's not congruent to me. It doesn't fit to me to see the data showing the results that we're seeing and knowing that the care that we're providing. So Julie made this nice little diagram up here that I think really describes the issue well, is we need to get people over to that great. We get a whole lot of good. We get a mixture of great and good, but we need a whole lot of great care being delivered. And what happens is, just as you and I, when we go out to eat somewhere, if something bad happens, that's what we tell our friends about the bad thing. We could have enjoyed 90% of the evening, but the fact that this happened is what we talk about. The same thing happens with our patients. So we're hypothesizing that we're doing a real good job. We just got to move the needle a little bit and spread the love. I say spread the love. We've got to get everybody to buy in and be invested in the patient experience. Whether you're an essential care services staff or a patient care delivery staff, we need everyone's buy-in. And I think you're going to think I wrote this story myself. I didn't, but it's actually a patient sent in these comments after, I'm going to call it a female, I don't know for sure who filled this out, but I'm going to say she. Don't know whether she received care on East or West, but it's a story that sort of highlights exactly what I think our situation that we're in. She says, I was taken care of by some very nice, caring staff. My room was just outside the nurse's station. During both nights, whoever was out there was loud talking and laughing. It was impossible to sleep. Other times I was attended to by caring people. I'd never stayed in the hospital before. I didn't know what to expect. I encountered some amazing, competent, and caring staff. You notice the back and forth here? So I encountered some amazing, competent, and caring staff. Unfortunately, it's impossible to forget about those who weren't. Patients are vulnerable, sometimes scared people. It's absolutely imperative that patients are treated with care and respect, not as a bother. So somebody must have gave her a nonverbal or something that thought that she was just a bother there for a moment. On the flip side, here's how she ends. Some staff were very caring and respectful. So you can see that story sort of tells exactly what I'm talking about. Lots of good things happened for this patient while she was here, but she noticed those few times it didn't happen. What can we do? You're going to have to bear with me a little bit. You'll get where I'm going with this story, but when I came to work today, I usually start my day either at Life Point or on West at the Independent Center. I drive to work knowing pretty much the exact parking spot I'm going to park in because I get there so darn early. Sometimes Mary Gates beats me, but and when I pull in, I don't have to think about, is this a patient, would they want this spot or not? I know I'm in an employee parking lot. I know how to get to my office. I know what time the cafeteria opens. I know which days I want to go down there and which days I don't. I'm just kidding. Hope Mike's in the room. I know who to call. I know a lot of people. I've been here 19 years. I know who to contact if I have a question. I know my way around the hallway. I remember the days we used to call the long highway Interstate 80 back during the construction over there when we went to private rooms. I have my little Android in my pocket, and I'm able to pull it out at the beginning of the day before I leave home and decide, do I put a tie on today or not? I know when I look at my schedule what's going to happen generally. Yeah, there's surprises in my day, but generally I have a pretty good plan on what's going to happen today. I knew I was doing 4 of these today, and I can set that plan in motion. Nowhere on my Android, nowhere on my Outlook calendar did it tell me I was going to get poked today, except on flu shot season. Nowhere did I anticipate a lot of uncomfort in my day, a lot of surprises. I didn't anticipate anybody telling me I had to take my clothes off and put this stupid gown on, okay? So what I'm trying to contrast is imagine how you each have your story of how you come to work. You know where you're going to try to park. You know when you're going to try to eat. You know where you're going. You know who to contact. Our patient experience, and this is what I want to get you in touch with, our patient experience is totally different than that. They may be driving onto our campus for the first time. They're trying to find a spot. They don't know how soon they got to be there. They get in the front door. They look for an information desk, and thank goodness we have the volunteers sitting there to help them. And then they're walking down the hall. They don't know where the cafeteria is. When they get to the cafeteria, when you first walk into our cafeterias, as nice as they are, it's a little overwhelming, both of them. Your first time you walk in, where do I go for what food? Where's the restroom? I know where the restrooms are. I know when I leave my office at the Independent Center, if I forget to go to the restroom before I go over to the hospital, I know where they're all at in the hospital. Our patients and our families don't, okay? So their experience is totally different. Plus, add on top of that, you know, I didn't expect to get poked today or have anything uncomfortable happen, but they're all here because something's going to happen to them today. Somebody's going to intervene on their lives, hopefully in a good way. Hopefully there'll be good outcome. But it's not usually a day they're looking forward to. We don't have anybody admitted to the Independence Center that says, hey, I'd love to come. Can I please come to treatment? You know, lots of times our patients are coming to the hospital expecting some uncomfort. So we want to change that experience as much as we can. And so where do we start? I mean, what can we do? Now, I'm going to speak a little bit with my counselor hat on here for a moment. One thing I know about being a counselor is it's really easy to tell people what they should do, could do, maybe if you tried. And I know that if they do it, things would be better for them. But it's a lot easier to deliver that message than to have people follow through with it. So what I'm about to ask you is to do something that I think will really change the patient experience scores throughout the entire organization. And it's going to sound real easy, but it's tough to do, and you'll have to do it every day. We need to get outside of ourselves. I mean, I could walk off the stage right now, but we need to get outside of ourselves and try to, when we walk down the hall, try to catch the eye of patients and customers. Try to see if there's anxiety, if there's uncomfort, are they lost? I'm really hard-pressed to imagine anybody in our organization that doesn't walk our halls, that doesn't go to our cafeterias. I've even helped some people out in the restroom. I won't tell you all those stories. But there are opportunities for every single one of us to make a difference. But the only way we're going to do it is, I'll give you the example of pulling in and parking the car. Am I pulling into the parking lot trying to find the places the closest to the door for me so I can get in quick? Or am I pausing and saying, would a patient be better to park here? And can I walk a little bit further? It's that type of attitude that we're going to set aside ourselves and try to anticipate what our patients and customers need. So that's one thing. The other thing we need to do, I think, is know that everybody has an impact rather than me trying to convince you. I would like, if you think you're in the room and you think you can't impact our patient experience scores, I'd love to have you email me or call me up, because I think I can find a way that you could. If you walk our halls, if you go to the cafeteria, you can impact the patient experience, or at least their families. Wouldn't it be cool if the family goes back up to the patient rooms and tells this cool story that just happened down in the cafeteria? I think we can all impact the scores. But sometimes what we have is we have people walking down the hall with their head down, not watching for clients. We get on our own mission, and I do this too. I get on my own mission. I know where I got to be and where I got to go, and I can't stop and talk to people too long or I'm going to be late. We lose track of our primary focus, which is to pay attention to our patients and customers. So where do we start? We created, and hopefully you all picked one of these up because you're going to be hard-pressed to read it on this screen. What we did, the group of 4 that I've had the pleasure to work with here, is we took what I call a deep dive, and we looked back at all the previous documents that have been created around patient expectations, behavioral guidelines. Those of you that have been here more than 10 years have seen various versions of this come out. What we did is we consulted with the ACE team, we consulted with the director group, the manager group, we consulted with Merrick Medical Center, CREAT, and we tried to take the lowest hanging fruit and package it on this document. So what you find on this document are the things that we think we either learned from Studer, or we learned through experience, or we just know they work. And we've kept those. And so we're hoping this sheet can stay the same for several years to come, so we can just all focus on these things. Notice some of the things that are on there. What's on there is "Ate It." We really believe that that makes a difference. And so we didn't want to get rid of that. We really believe if you've ever been to another medical center with your family members and you've walked in and somebody came in and started talking to you and they didn't do their "Ate It," you noticed, didn't you? You notice. So people notice the "Ate It." They notice when we greet them with the 10-5 rule in the hallways. That's on there. They notice when we manage each other up. And I'll tell a quick personal story. One of my twin daughters had back surgery here, I'm thinking around 10 years ago, over on West. And my wife and I were sitting waiting to be called back. And we're waiting. And this nurse, I wish I knew her name today. Maybe she's in the room. But she came out and she said, "I know you guys are waiting here, but you need to know you have one of the best surgeons that we have. He really takes his time. He's usually late, but that's a good thing because he's taking his time with the patients." There's a dad that all of a sudden felt a lot more comfortable and a lot more reduced anxiety because I can wait and I can be late to the appointment if my daughter's going to get good care. That was a beautiful example of managing up. So I was anticipating to have the best surgeon on West Campus be cutting on my daughter. So we package these, and we know that packaging them in and of themselves and handing them out to you isn't going to make the difference. What's going to make the difference is if you live it and you own it. and you walk the halls and figure out how you can help it. But to add to that, we're creating a system whereby in March and April, you will all be rounded on by your leader in March and April. And if you're not being rounded on, please let us know that too, because everyone's supposed to be experiencing some time with your direct supervisor. And I see some nonverbals that I hope you call and let us know, because if you're not being rounded on some of the nonverbals I just saw, I'm not going to look at you. Let us know, because that's supposed to be happening. In March and April, they're going to pull this sheet out of their desk, and they're going to lay it out in front of you, and they're going to ask, have you seen this? Did you go to the forums? Did you see it? And all you will be able to say, yeah. And they're going to have you look at it, explain it, see if you have any questions. And then what's going to happen on April 1st is it's going to be loaded in Catalyst, and we're all going to get this email saying there's a Catalyst assignment that's due. And when we open up the Catalyst, it's going to be the simplest Catalyst you've ever done. Open up the Catalyst, it's going to have you read this and acknowledge that you read it, and acknowledge and commit to following through. Now, in the earlier forum, the 8 o'clock forum this morning, somebody raised their hand at the end and said, what makes you think something like this, I'm paraphrasing, what makes you think signing a document is going to make a change? Well, it's not the signing of the document, but it's the commitment. It does. I've been working with behavioral change with addictions for 38 years. And if I can sit a person down one-on-one and get them to commit to make a change about something, it's a whole lot different than if they didn't. Okay, so every April, this is going to show up as a reminder. We're going to go back in and look at it. If you're hired after April 1st, it's going to be loaded in Catalyst upon hire, and then the first of the second quarter from there on out. So that's what I wanted to share today, but really the take-home message, if I could try to change your behavior, it would be walk the halls differently, walk into the cafeteria differently, be on watch for a way that you can help. Thanks, guys.
Good afternoon. My name is Brooke Coase. I'm the Director of Education and Organization Development. I have been in this role for 11 years, and this is the 8th year we've facilitated this employee engagement survey. So I'm excited to spend just a few minutes talking to you about the upcoming survey. Last year we branded it the Pulse, because we really do believe that this survey gives us the pulse of your experience here at Bryan, and are looking forward to hearing what you say this coming year. Before I get started into our last year's results and what we've done and some other details, I want to take a minute and just talk about why do we survey. Jerome does a great job of explaining, the impact that each one of you makes on the patient experience. But when you look at our perspective, is that truly the more engaged you are as an employee, the more you love your job every day, the better care you're going to provide our patients. We also believe the more engaged physicians are, the better care they're going to, and all providers, the better care they're going to provide our patients. So that's why we focus on employee engagement. We want to make Bryan a place, a work environment where each one of you really does want to come every day. And you all own a piece of that, because part of that is us choosing to come to work engaged, but part of that is us creating a culture where this is a great place to work. And that's the feedback that we really look forward to getting in the survey. When I look at 2018 results, you'll see on the far right, the engaged section. You can see that we took a dip last year. In 2017, we had 52.5% of our employees engaged, and we're at the 80th percentile. And we took a drop to 47.1%, and we're at the 64th percentile last year. We had made great strides over this last several years, and are looking forward to seeing where we are at this year after this survey cycle. Percent engaged is the gold standard that advisory board has encouraged us to hold ourselves accountable to. They called me a couple years ago and said, quit holding yourselves accountable to the engagement mean, which is the average of all of them, because you really are a high-performing organization. So I'm excited to see, hopefully, our scores improve. You'll remember at this time last year when we surveyed, it was April. We had just implemented Epic. We had really high volumes. We had a lot going on. And I don't know if that contributed or not. Because honestly, there's no excuses. We all need to be great leaders, and we need to make sure that we are engaged every day at work. But it'll be interesting. We're looking forward to your feedback to see if we've improved. I want to take a few minutes and share with you what we've been working on since the last survey. So the first thing you told us last year is that you wanted more effective leaders. You may not have realized that you told us that, but that is what you told us. There's 10 questions on the survey, and they're up here, but looking at work-life balance, effective performance reviews, career conversations, feedback from your leader, all of these things lead to an effective manager. And we saw a decline in all of these questions last year. So we spent the last year really looking at what can we do to improve leader effectiveness. For those of you that work in an education area, you know that you can't turn on a dime and develop new curriculum and get that out really quickly. So we hope we see improvement this year, and we're anticipating we'll see even more improvement next year. But what we've worked on related to these questions, the first thing is your leader should have done action planning sessions with you when they got their results last year. And we asked every leader to do an action planning session with their team, talk about what they were going to do differently based on what you were interested in doing differently as a team. But then every leader was also supposed to pick one thing related to the previous slide and work on it and commit to working on it as a leader. So hopefully that has made a difference in leader effectiveness. Your survey results also drove the content for our September and our January Leadership Development Institutes. We brought in Cy Wakeman, who has a concept called reality-based leadership, and brought her in and one of her colleagues in January, but we focused on accountability. And what does that look like? And what do we need to be doing as leaders? That was September, and then we brought her colleague back in January and talked about broadening our mindset of how we're providing feedback. And making sure that we're giving you great feedback during performance reviews. So we hope that that is going to make a difference. We also redesigned our entire leadership development curriculum and just rolled that out at the January LDI. It took us a long time to evaluate, are we even providing the right curriculum and what's that look like? Also coming in the April LDI is a coaching curriculum for all of our leaders. So that way we really are giving better feedback to you every day. The last thing we're doing for leader effectiveness, Jerome mentioned that you should be getting rounded on, and it should either be monthly or every other month, depending on your leader's span of control. One of the things that we've received feedback on, some leaders have up to 90 direct reports, is it's hard for them to follow up. It really is, they want to round on everybody, but they're not necessarily as responsive. So many of you are probably familiar with Noble. We use it for hourly rounding, and we use it for rounding on patients as well in the clinical areas. And they have a tool that's leader rounding on employees, and are looking at implementing that tool sometime in the next couple of months. So that way we can help leaders be more efficient in that process, but also that will give us insight into who is and isn't rounding, which we haven't had easy insight into before. The next thing we looked at was a focus of recognition. This is something we've looked at the last several years and continue to try and find ways to improve. But there's a question on the survey of my organization recognizes employees for excellent work. And we have a commitment and a focus to continue our recognition work, but there were a few things we did different last year. We know that this organization had a major lift with the Epic implementation, and so we did, if you all remember, there was the Valentino's voucher that came out for all employees right around the Epic Go Live. And then the other stuff is stuff we've previously done, hospital week celebrations, picnics. We're fortunate to be able to continue the Russ's gift certificate around the holidays for everyone. And then hopefully all of you received just a couple weeks ago the last Visa gift card for the Epic implementation. So we really have focused on what are we doing to make sure we are giving back to the entire team that's really contributed to our success. We've also received feedback that you value the employee and family focused events. So the movie event, the HR team does a great job of coordinating that, and it is next week. So if you haven't signed up, please make sure you sign up. Cookies with Santa, they have coordinated in December. We knew this year we had free admission to the Children's Museum over Christmas for employees, grandkids, kids, and we just received numbers yesterday. We're about 570 employees that took advantage of that. And if you didn't, it's coming again over spring break. So make sure you pay attention to that and participate. And then the last thing that we continue is the Salt Dogs event that if your kids are members of the Kids Club, the Bryan Kids Club puts on in June or July, June. Questions about what we've done so far for the survey? Any? Okay. New this year. One of the things we continue to focus on, I know John didn't have slides on where we're at with our quality, but one of the things we track is harm events. And it is really important to our mission to continue to work toward achieving zero harm. But in order to do that, we need to make sure that the environment that our caregivers are working on or in is as safe as it can be. And we need to understand your own attitudes versus, our reality of what's happening in the clinical areas. So we are adding Press Ganey's safety culture questions to our engagement survey. You won't, only for people providing or working in units that provide care, clinical areas. So not all employees will get this. So there's 19 additional questions that are going to ask things like, I can report patient safety mistakes without fear of punishment. Here's just a few samples on here. In my work unit or department, we discuss ways to prevent errors. We're really looking to, are we creating that learning culture? Is it a safe place for people to make a mistake, but then talk about what we're going to do to stop it from happening again? And look forward to your feedback so we can continue to improve our safety culture here at Bryan. One thing I want to note is that these questions are only going to be added to the survey every other year. It's not going to be every year, but because some of these changes take a while to implement. Frequently asked questions. Okay, the survey is going to launch April 9th. You will get a survey from Advisory Board Survey Solutions. It's open for just over 2 weeks. We make sure that we cover 2 weekends. And you will get lots of reminders. The way that we know you haven't completed the survey, I never know. Advisory Board knows based on a unique code that every employee has. So please complete your survey. We really do want your feedback. Is the survey confidential? Yes. Every employee has a unique identifier. I have no way of knowing if you completed or not. And your leader doesn't get a report unless they have 5 employees complete the survey. So that's the standard advisory board uses to say that something can be anonymous. If you have a question, the next question, what if a question doesn't apply to me? I do get this one a lot, especially if there's PRN staff completing the survey. You can skip a question. There's only 4 questions on the entire survey that you can't skip. It's the first 4. After that, if something doesn't apply, just skip it. You don't need to feel obligated to try and rate it on a scale. The last thing people, what does the survey mean when it says your manager? I want to skip this one. Complete the survey for your direct supervisor. If your direct supervisor's title is a director, answer the question like they're your manager. If their title is a supervisor, that's who we're talking about in that question. So make sure you're thinking of the person that you interact with most frequently. And we pull this data file for advisory board on Friday. So if any of you are getting ready to transfer to another department, and so in April you won't work in the department you're working with or working in, we encourage you to please complete it based on your previous supervisor, because the data file's pulled on February 8th. It takes a while with almost 5,000 employees to get everybody set up in the survey. Okay, I just want to encourage all of you to take time to give us your feedback. When we look at being an employer of choice, one of the things that we know is it's a really great opportunity for us to create a conversation with you and to act on your feedback. So please take time to complete it. Our goal is to have 85% of our employees complete it, and we've achieved that the last several years. And just a little extra enticement, we'll have 40 Visa gift cards we're giving away to encourage you to give your feedback. So any questions for me? Yes.
You had mentioned some of the questions that if they don't pertain to you, the answers do not pertain. I know on our unit, one of the questions is, are you interested in a promotion or something? And a lot of people will answer no because they're perfectly content where they're at, but then it continues to come up as negative.
Yes.
So it's hard because I wouldn't think of that, but a lot of people don't if it doesn't apply.
So, her question was, there's a question on the survey of I'm interested in promotion opportunities in my unit and department. It's a question that's been an opportunity for us almost every year that as an organization, almost every year that we've facilitated the survey. And That question is going to be on the survey, and I encourage you to do one of two things. First of all, we oftentimes think of promotion opportunities as climbing a ladder. It doesn't have to be that way. It can be, I'm interested in stretch assignments and taking on additional responsibilities, serving on special teams or projects. I would encourage you to think about it that way, but also you can skip the question. I mean, if it doesn't pertain to you, instead of scoring it negatively. Does that help? Little. Any other questions? Okay, thank you.
Thanks, Brooke. I have some updates to cover with our renovation project going on for transforming surgery. So I want to start with the picture. So this doesn't work on that. The pink area right here is a staging area. This is the college, so that's the lot across from the college. And we're going to take out about 50 to 60 parking spaces there to stage our materials for this project. This project lasts about 3.5 years. But what we're going to do is ask those individuals, which is primarily faculty and staff, to park into that 50-55 parking lot that's just to the north of it, so that we can have enough room for our staging. So you probably noticed a fence going out up front of the building, and that's where we're going to end up putting a crane and going to kind of be the work area for our construction folks. We're also going to change the parking up front. Last week or the week before, you may have seen them put in a different drive in there, and I'll show you a picture about that later. And then our shuttle, because it's going to be so tight in that area, especially the first 15 months, we've relocated the shuttle. So if you go out this back door here, that's where the shuttle will be dropping off. And then we talked about the surface parking there. So if you take a look, this is the front of the building. You see the Ackley Tower entrance down there at the bottom. You see where the plaza entrance is at. Where you see the red line, that's the fence that's going up right now, and that'll be the construction area. And later on, they'll move a crane into that area, and they're going to move a crane over by the Fairview home as well, because they're going to end up be passing goods back and forth as we construct in that area. You'll see that that drive that just went in, the little curve that goes around once you drop off at the Ackley Tower. Let's say you're not dropping off, but that's just your entrance in. You've got to go around that little loop if you're trying to go to the plaza. So it's going to be really important that our valet folks is keeping that traffic moving out there. And you'll see that we designated a 15-minute parking area out in that other lot. And that's going to be for those people that do the quick deliveries running in and out, or they may be picking somebody up and put their car there for a second until they come around. So it's going to take quite a bit of coordination during that time. And then I'll show you later about the advancement office moving, but right in front of our advancement office on the first floor is the U.S. Bank ATM. Because that space will be renovated, that's moved to the little corridor right next to the elevator at the Faulkner building. So if you're looking for the ATM, that's where it went to. So we've completed what we call phase 0 before we started the project. And that was, if you look across the hall here, that's the new surgery staff locker rooms in the area that used to be the cafe. The main entrance drive's been updated. And then next week, the advancement department will relocate to where the ENT offices used to be across the hall here, because the ENT offices moved to the 50-55 building. And then what we will do, and we talked about the shuttle drop-off as well, and I'm going to show you pictures later about the stairwell that'll run where the advancement office currently is at. So you see that stairwell. So folks, when they come in the door and they see somebody at the information desk, they have the option to go down the hall and take the elevator like they used to, or you can just point them to the stairwell. And then there will be additional seating on that first floor as well. When we start this construction project, we're actually kind of bumping out the front part of this building, and we're going to build 11 ORs. And because of us shifting the ORs, sterile processing is currently located underneath our OR proper. When we build these other ones, it's going to be a little bit off. And there's a lot of traffic that goes back and forth, especially carts, clean supplies, dirty. We're going to shift the sterile processing department a little underneath the OR so we can utilize that elevator system. And that work has been happening prior to us starting this big project because we were kind of phasing it. So plant operations moved in some of those folks' facilities in preparation for sterile processing. So here's a lot of things that have occurred. The temp drive went in. The fence is going up right now. We're going to begin basement demo and pharmacy locker room closure. The biggest thing, 2 North closes the 10th of this month. That's a 17-bed inpatient unit. And we knew we were going to do this in the plan, and that's why we opened up other areas. So we've added a overflow unit on the west campus. We moved the SIM center and opened up a 11-bed unit over there. We opened up 2 more ORs on the west campus. We're in the process of moving the sleep lab from the west campus to the 6th floor of the Edwards building, and then we will open up where the sleep lab used to be to an 11-bed inpatient unit. We've convinced about 8 doctors to shift not all of their volume, but a good chunk of their volume from the east campus to the west campus, because we're trying to shift that inpatient volume because we knew we were going to lose those beds. But at the same time, while all this is going on, unrelated to this project, we are going to move the pulmonary department off of 5 East and build that as a 17-bed unit. It'll just be about a year from now, a little over a year from now, that'll be completed. And then advancement, we talked about move, the stairwell will start. And then the 2 North, that was an inpatient unit, will actually be used for our outpatients for the surgical area. And then additional demo, that elevator shaft will come through our lab area. They're aware of that as well. And there will be a period of time where the Cafe Express closes. I heard the Starbucks people moan already. But we will move that to the cafeteria and offer that service. And the reason why we have to do that, that skylight that you see will go away because that becomes part of the 2nd floor that we need when we expand the 2nd floor space. So what I've covered with you so far is just phase 1, well, phase 0 and phase 1. There's actually 5 phases of this project. So this only takes us through the first one. We will continue to update you because to lay it all out will be very confusing. The people will give it to you in chunks and different information. So this is what our front entrance will look like. So this is 48th Street right here. And people will come in, so if you're driving a car, a Jeep, a truck, whatever, you're going to end up coming in through this area. And then you see if you drop somebody off, you can come out this way and then hit into the garage. If you're just coming all the way through because you want to go to the plaza, that's where it gets a little crazy because you got to loop around. But we'll have signage out there to try to direct people around that area. And in that red space out there too, you know, we do know that we have ambulances come in, like let's say they're picking up a NICU baby to go to the university or children's or wherever. We made sure that we made accommodations for those as they occur as well. So does that give you a little idea of the flow? This is about 15 months that this looks like this. Actually, at one point it was a lot longer. I give a lot of credit to the team that continued to squeeze this down and squeeze it down because it's the front entrance to our hospital. You don't want to make it look like a war zone as people are coming into our facility. And then if you go on to hello and you see the red circled area, keep checking on that. That's where we're going to give updates. We'll continue to give updates to people in forums and other avenues, but that's a great way to just see what's happening if you have questions. And then also there will be videos that come out. We're going to call it the Bob and Don Show. And it will give you updates of what's happening in regards to the construction. And once again, to just reemphasize, 3.5 years that we'll be going through the phases of this. Then I wanted to update you on some security enhancements. I think at the last forum I talked about this as well. We had an outside company, and we do this periodically. They come in and give us ideas of where we could help make this a safer environment for you as staff, for our patients and our visitors. So here's some of the things that have already been done. We added an armed officer to both campuses to be inside of our emergency departments. And we already had armed officers, and those will float throughout the rest of the building, but the other ones will stay in the emergency departments. Then we implemented a 2-visitor policy a while back for our emergency department. We were finding out that we were having crowds of people, and it's hard for the caregivers to give care. And then also when they would spill out into the hallway, we have very busy emergency departments. They were here in the business of everybody else. So we've done a lot of signage to educate people. The people in triage are letting them know up front. And so far, in fact, we had a meeting with the ER docs, and I think it's working pretty well. We haven't had any incidents where people refuse to leave. But we also give our staff the credit that if, something major is happening that they need to have more than 2 people and it doesn't affect the care, do that. But don't do it all the time, because other people will see it and say, hey, they've got 4 people in the room. You have to use that pretty cautiously. And then what we've done is we don't want to put our providers in the middle of it. So let's say a person comes in with 1 person with them, and then later on family shows up and 2 more come back. If the nurse says something to them and then they won't leave, then the nurse ends up calling security, and then the nurse is in a tough situation. So what we do is we ask the nurse not to say anything to the family, but to just call security. And security will come by and they'll just glance into the room and say, hey, I was doing my rounds and I noticed there's 4 people in here. We have a policy of 2. Can I take 2 of you to the waiting room? So it's more scripted, that they weren't called upon. They were just rounding, so that we try to make this as convenient as we can for folks. And then we're also looking at a badging system. And we're going to start with our OB tower. I think they've selected the system they're going to use. And then on the first floor of this building, we'll put a little desk, and everybody will need to check in if they're going to go into the tower. And as we develop that and see how it works, then we're going to roll it out to our emergency department and mental health as well, making sure we know who's in the department, and especially during night times. We may expand it more just to the doors when people come in on the night shift, so we know who's in our building. And then we're putting lockers in. I think they've been ordered now for the emergency departments and the mental health ED, and it's to store the baggage that people bring in. One of the things that we've heard from a lot of our staff is, when somebody comes in, let's use the emergency room as an example, and they're bringing these bags, we have no idea what's in them. And what we're asking them to do is they put them in a locker, and we'll have like a clear Ziploc bag, and they'll throw their phone in there and probably their insurance cards and their meds, and they come back that way. And if you guys really think about it, if you go to the Pinnacle Bank or you go to a Husker game, you got to bring in a clear bag. And we're just trying to do something to be more proactive and cautious about what people are bringing into the hospital area. And there's more things that will be happening in the future. These are some that have already been put into play or about ready to go into play. With that, I'm going to ask Lisa Vail to come up, and she's going to share about our pain management and opioid stewardship program.
Good afternoon, everyone. Lisa Vail, CNO, been at Bryan 6 years now. And it is my honor to be the executive sponsor of our pain management and opioid stewardship program. This team launched back in the fall of 2018, and we are following a roadmap of well north of 100 different interventions and strategies to create a safer experience for our patients. So I'm just going to spend a couple minutes and talk through those with you. You guys have seen it just like I've seen it. It's in the headlines, it's on the radio, it's on the TV. In fact, last evening, Dr. Zock, our medical director, actually did an interview, I think it was on the Channel 10-11 News, about the opioid epidemic. And so it's not, we are not protected living in the middle of the United States. We are not in the same situation as the coasts and some of the other really impacted areas are, but we want to stem the tide, we want to turn the curve, and we want to do everything we can to create a safer environment for our patients here in the Lincoln community. So these are just some of the vital statistics that talk about the scope of the epidemic. This data is from 2016 and 17. 130 people die every day from opioid-related drug overdoses. 11.4 misuse prescription opioids. And you can read the rest of these numbers. I'm not going to read them all to you. But when you're talking millions of people being impacted negatively by the misuse, overuse, addiction related to opioids, we need to take action as healthcare professionals. So it is opioids, narcotics are a type of prescription pain medication. Some of them are legal. You can actually go to your doctor and get a prescription for them. Some of them are street drugs. So we are dealing with a very complex situation. We're not going to be getting into trying to control heroin, but we are going to do everything we can with the controlled prescription legal medications on our side. It's important not to forget, though, that these medications have a really important role in the treatment of pain, but they also come with serious risks. So we have to figure out how we can mitigate those risks while still providing exceptional care to our patients. As I said, the data was on the previous slide. I don't think there's anything new here in the rest of this one. But it really is being called an epidemic. This is an epidemic in our country. So our pain management and opioid stewardship program is an interdisciplinary team of 26 members, and what we are trying to do is really look at broad culture change for Bryan Health. It is to ensure safe and appropriate use of opioids, promote the evidence-based pain management, and reducing any risk of adverse outcomes, including addiction and overdose. This is the team. Dr. Zock, as I said, is a board-certified anesthesiologist and pain management specialist. He is our medical director. I'm the executive sponsor. Celia Westkamp is our phenomenal program facilitator, and she's back there. I'm going to give Celia a lot of credit. She's keeping us all online, and we need that. Wendy Muir, Ruth Van Gerpen are a couple of other subject matter experts that are leading some really important sub-teams related to caregiver and patient education and engagement, as well as policies, procedures, and workflows. And then Angela Herbert is, of course, our metric queen with the organizational quality department to help us look at how we are performing within the organization. I'm really excited, though, that we've got 9 providers who are active on this team. They come to these meetings every month, and they are engaged. We've got surgeons, hospitalists, emergency medicine, anesthesia, trauma, and the intensivists. So really broad-based participation, interest, and desire to help create a better environment for opioid use at Bryan. And then we have some clinical experts as well in our pharmacy, behavioral health, physical therapy, and of course our EPIC team, because some of the changes we are going to make will impact how we document in the electronic medical record, order sets, other things as well. And because this is a Bryan Health initiative, not just a Bryan Medical Center initiative, CREAT and MERIC are also included in these conversations. So the initial focus is dealing with what's happening in-house first. We're really looking at those hospital-based and particularly med center-based practices, starting with education for our clinicians and providers, understanding truly what this epidemic is all about. We will be shifting away from the traditional primarily 1 to 10 pain scale that we use for most adults and moving to a function-based pain assessment. There will be a lot of education that will come with that, and that will roll out in May with our May EPIC update. We just approved an order set for the use of ketamine for pain management in the ED and some of the other very specialized areas, and we're trying to really work on multimodal pain management. Not everything has to be an opioid. What happened to good old Tylenol and Advil? There are ways and reasons to use those meds as part of our overall package. Also looking at that transition of care piece. How do we get patients help who have an opioid use disorder? And we are really blessed here at Bryan to have a great program at the Independence Center to connect those patients with. We'll also be working with the community once we get our in-house business in order, connecting with other providers, other healthcare agencies. We want to be having conversations with not only Bryan College, but other academic centers on what is being taught in school. We want our future nurses and PAs and CRNAs and everybody else coming out of school with evidence-based knowledge about best practice with opioids and pain management. So as I said, the functional pain assessment is going to be coming out in May, really looking at how we can get patients up and moving and doing the things that they need to do for speedy recovery, and then some really good non-pharmacologic, non-drug strategies. Heat, cold, relaxation, breathing, music, diversion, there's just all different kinds of things. The key is getting the patient involved in this conversation, managing expectations upfront and early, and not telling them that having a major abdominal surgery is not going to hurt at all. That is not the message we need to be telling these patients. They have to have a realistic understanding that they will experience some discomfort. So that's all I have related to the pain management and opioid stewardship program that's coming. This is a multi-year project as well. I hope we get most of our stuff done before 3.5 years, but like the construction, but it is a big project. So I'm happy to answer any questions at the end, or you can send your questions into the center. Thanks.
And just a few more items to wrap us up. You know, we've been promoting my chart quite a bit to folks, and I just want to play this little presentation. And this is viewpoints expressed by patients, by our own employees, by providers. So we have over 30,000 people. It's been about 11 months now on my chart. If you as an employee are not on it, please get on it so that when patients ask you questions about it, you'll know how to maneuver through it and explain the benefits to them. But some good progress in our first 11 months. And then we wanted to comment about our bariatric program. We started that a few years ago. And you had to do a certain number of surgical cases before you could even apply for the accreditation. And you have to, of course, meet a lot of quality metrics. We have done that and had a surveyor come in and we received our accreditation. So what's really neat about this is right now, for all of the patients that we've seen, few insurances were covering the bariatric surgeries unless you're an accredited organization. Now that we're accredited, there'll be more insurances that cover it. So a lot of these people that were having these procedures done was paying a lot of this money out of their own pocket. But some good news from our bariatric perspective. Then if you noticed in the information that you picked up today, some of our new branded templates, and we just want to remind people and encourage you again that whenever you're doing things, especially that reach out to our public, please make sure that you utilize these templates and you always have access to the people in advancement that will help you. We want to make sure that we put out a professional document as well as one that just relates people to Bryan Health. So take advantage of that as well. And then just some dates coming up. Talked about our performance evaluations for people. January 29th to the 10th, the leader completes them. The 11th through the 10th of March is where the leader will meet with the individual, and then both of you will sign off on that in Catalyst. We want to have all those done by March the 24th. And then Hospital Week we'll celebrate on May the 13th to the 17th, if you want to put that on your calendars. And then, as Brooke mentioned, we have movie night coming up, and it's on the 13th and the 16th. You need to register by the 8th because we want to make sure we have enough room for folks. And then the free Lincoln Children's Museum admission is occurring in March. And then our next forums will be on the 15th and 16th of May. And I open it up for questions. Just raise your hand. If you wrote one on a card, pass it down to Julie. She'll pick it up.